session. Gonna start off with a song called Lonesome No More.
And thank you all for being with us tonight to discuss what I think is an issue on the minds of millions of Americans. And that is not only the economic crisis that we are facing today, but the healthcare crisis as well. The fact that we have a healthcare system in which your healthcare in many respects is tied to your job. And we've heard what a wonderful system that is. Well, guess what? When you lose your job and tens of millions of Americans are losing their jobs, that concept no longer seems very, very good. I and the panelists that we have, the great panel that we have this evening, have a very different view of what healthcare should be. We do not believe that healthcare should be an employee benefit. We believe it is a human right that you should have healthcare, whether you're working, whether you're not working, whether you're old, whether you're young, whether you're rich, whether you're poor. That healthcare is a human right, not a privilege, not a job benefit. Now, we have a system today which to me is almost impossible to defend. We are the only major country on earth not to guarantee health care to all people as a right. Where I am speaking to you tonight in Burlington, Vermont, is 50 miles away from the Canadian border. And somehow in Canada, they managed to provide health care to all of their people. And by the way, they spend about half as much per capita as we do. Canada people live longer lives than we do. Their life expectancy is higher. Their infant mortality rate is lower, and that's true with many countries around the world. In the United States today, despite spending $11,000 for every man, woman, and child, we got 87 million people who are uninsured and underinsured. That was before the economic collapse. Much worse now. We lose between 30 and 60,000 people every year who die because they can't get to a doctor when they should. We have about 500,000 families that go bankrupt in America because they cannot afford to pay off their medical debt. And we pay by far the highest prices in the world for prescription drugs. Wow, what a system. And then we look at where we are today. And it's not just that millions of people are now losing their health insurance. We have to ask ourselves kind of a simple question that I will be discussing tonight. How does it happen that despite spending so much money on healthcare, we were totally unprepared for the pandemic that we're now experiencing? How does it happen that doctors and nurses, medical personnel do not have masks to protect themselves? You might think that's pretty basic. A gown, the gloves that they need. How come we don't have enough ventilators in our hospitals? And the question I also want to throw out today is that while I believe the current healthcare system, the employer-based system, is indefensible, well, why? How did we get to where we are today? Which has everything to do not with healthcare, but with a corrupt campaign finance system in which the healthcare industry last year made $100 billion in profit and therefore has enormous amounts of money to spend on lobbying. My God, they and the drug companies, they have lobbyists not only all over Washington, D.C., but every state house in America, which is why, among other reasons, the pharmaceutical industry can charge you any price they want for the medicine that you need. So we got a big issue out there. And tonight I am so happy that we have just a wonderful, wonderful panel who are with us. We have Representative Pramila Jayapal from the state of Washington. And Pramila is the lead author of the Medicare-for-all legislation in the House. We have Dr. Abdul El Sayed, who is the former, who is a physician, an epidemiologist, a public health expert, the former public health director of the city of Detroit, Michigan. We have Dr. Claudia Fegan, who is the chief medical officer of Cook County Health and is past president of the Chicago-based Health and Medicine Policy Research Group. And we have Michael Lighty, and I've known Michael for a long time. Michael was formerly with the National Nurses United, one of the great unions in our country, and one of the unions long advocating for Medicare for all. So let me begin with Representative Jayapal, who's going to have to leave us early, unfortunately. But I wanted to throw out a couple of questions to the Congresswoman, and that is, Pramila, how are we doing politically? In your judgment, are we winning more support for the understanding that healthcare is a human right, not an employee benefit?
And you know what Can you hear me now? Okay, great.
I can hear you now.
Thanks for having me here on this wonderful panel. Here's what I would say. I actually think that thanks to you, thanks to millions of people across this country who have been dealing with healthcare crises for decades now, that we have won the ideological battle. I actually don't think that we have to convince the American people. If you go across this country and you just ask somebody what is the biggest concern that you have today, they will say healthcare costs. And they will say that whether they're uninsured when it's really, really bad, obviously, or whether they have insurance and they're underinsured. They still can't afford the cost of healthcare that sometimes can run between $10,000 and $20,000 a year pretty easily. And so I think that this is not a question, as you said, of convincing the American people that we need to do this. This is a question of the political will. And this virus, this pandemic that we're in the midst of, has really made it clear how broken the system is. When you have chronic disease, chronic conditions that people have because they delayed healthcare, because they haven't been able to take their medications, their treatment, they are the ones who are most at risk for getting the virus. And when you look at the fact that, you and I, for years now, we've been talking about how there's no real choice in the employer system. Well, here you go. I mean, everybody said, oh, employer system offers so much choice for healthcare. No, not if you lose your job, it doesn't. And I think that employees have been saying that for some time. They don't want to be tied to one employer. They want their healthcare to be there regardless of who they work for, regardless of what opportunity they choose to pursue. If they need to stay home, they want their healthcare to be there. And so 35 million people potentially being added to the rolls of the uninsured, already 30 million, I think has shown people how politically necessary this is, how morally right it is, and how we just need the courage to, put the barriers on those 500 lobbyists for every member of Congress that exist in the halls of Congress. Stop listening to them. Let's start listening to the people.
Pramila, you have done a great job in the House. And as you indicate, I don't think it's a question of winning over the American people. I think they are there with us. I'll talk a little bit about the kind of progress and support you have for your legislation in the House.
Yeah, it's been amazing, actually. We were able to get 4 hearings in the House of Representatives and major committees of record. That's the first time that has ever happened on a single piece of legislation. We have over half of the Democratic caucus, including most of the leadership, signed on to the bill. And we have built tremendous support with you of labor unions. This is the largest coalition of labor unions, because I think sometimes people don't realize this, but if you've got $1 at the bargaining table and you got to spend 60 cents of it on healthcare, that only leaves 40 cents for wages. And so unions are clearly seeing the stagnation of wages being tied to the increasing amounts of healthcare costs. But also we've built the first major racial justice coalition for healthcare now with the NAACP and many other racial justice groups saying, we know that Black and brown folks are deeply disproportionately affected. You certainly see it in the fatality rates of African Americans with COVID. 70% in Chicago of the fatalities are African Americans, 81% in Milwaukee County are African Americans. This is criminal. So we're excited about the support we've built in the House. I believe we can continue to move this. And this is actually a really good time. And we are ramping up our efforts to say to people, this is the solution we need. We can't hide behind, oh, it's too hard. Oh, it's too difficult. This is not naive. People are dying because they don't have access to healthcare. And if we had a centralized system that assured healthcare, we would still have a pandemic, no question about it. But our response would be significantly faster. We would have significantly less chronic conditions, and we would be able to come out of this with some real lives saved. And that needs to be our focus.
I think one of the points that Pramila just made, and we discussed this issue here a couple of weeks ago, is that when you have poor people, when you have African Americans and Latinos who don't get the health care that they need, who are living in poverty, what you have is a lot of untreated disease. You have more diabetes, you have more high blood pressure, You have more obesity. You have a variety of illnesses which this horrible virus is preying on. So people who have poor immune systems are the most vulnerable to this illness, and those people who have not had the health care that they need are in fact the people who are dying in the highest numbers. Okay, we lost Pramila's sound. Pramila, you there?
Here.
Okay, good. Oh,
Can you
you're
hear
getting
me?
calls on your phone. Okay.
Yeah.
All right,
sorry
with
about
that, let me, Pramila, thanks a lot. I know you've got to run.
Thank you.
Thank you for being here, and thank you for all the great work you are doing. Let me go to Dr. Abdul Sayed, who is in Michigan. Dr. Sayed, thank you very much for being with us tonight. Why are you a supporter of Medicare-for-all?
Well, it's always a privilege to join you, Senator. I really appreciate the opportunity in the space to talk about this critical issue. I'm going to give you three reasons. The first is because I used to serve the city of Detroit as health director. And in the city, so many people lacked access to a resource as basic, as fundamental as healthcare. And the cruelty in the city of Detroit is that we're just across the river from Canada. We can see a place where they live on average 2 years longer than we do. Like you said, they have lower infant mortality. They're happier with their healthcare, and it costs them 60% as much as our healthcare costs us. And Detroit is a disproportionately low income, disproportionately Black community that has been marginalized in so many ways because of the structural racism that is rampant in our society. And that means that not only do people lack access to health insurance, but because of the system of corporatized for-profit healthcare, there aren't even clinics in their neighborhoods. Because of course, if you have insurance in a community like Detroit, you're on Medicaid. And Medicaid reimburses a lower rate, which literally says that the value of healthcare to you is less than the value of healthcare to somebody else. And so a lot of these clinics don't move in. And so it's not just that they don't have healthcare access because of the lack of insurance. It's also because they don't have healthcare access because of lack of clinics, because the reimbursement rates in this system that is so disjunct and disjointed, and that basically values people's lives based on the value of their paycheck, that they don't have access to healthcare that way. That's number one. Number two, we're in the middle of a global pandemic. And you ask yourself why our healthcare system was so ill-prepared for something like this. Well, it's because we run healthcare like a business. If you're a business, one of the first things that your management consultants tell you is that you should do what they call just-in-time supply. Just-in-time supply means that you don't have PPE, you don't have ventilators, and you don't have bed capacity when a global pandemic hits you. And then you also think about why it is that right now our healthcare system is not just battling COVID-19, but almost every hospital in the country is also battling bankruptcy. And that's because the most lucrative reimbursements that they get are for the kinds of surgeries, the kind of elective procedures that people don't necessarily need urgently. And so if you're facing a global pandemic, you cancel your elective procedures, which means you're basically canceling all the money coming into your hospital, all of which speaks to the fact that a hospital shouldn't run for profit in the first place. And then the last piece.
Let me jump in on that one if I could, Abdul. And what we are seeing in the worst healthcare crisis in the modern history of America are doctors and nurses being fired. Is that correct?
That's right.
By the
hundreds. That's exactly right. That's
How
exactly
insane and irrational is that?
Yeah, and they're telling them, look, at the end of the day, we can't pay your salary, so don't come. And we're also being jammed with COVID-19 patients. And then the last point that I was going to make, Senator, was this one, that we think of ourselves as the consumers in healthcare. And I just want to explain something here. Imagine here are the payers, they're the insurance companies, and here are the providers, they're the hospitals. When you get sick, right, you go to a hospital and you get your care. You're diagnosed and you're treated by the hospital. But the payment doesn't necessarily come from you, even if you're insured. The payment comes from your insurance, which, by the way, is behind a paywall. So you've paid a premium every 2 weeks, every month, so that these folks will be there for you when you need healthcare from these folks. And the problem is that you then have to pay a little bit more to get access to the healthcare you already paid for. But here's the crazy part. The money is transacted between the insurance and the providers. If you think about it for a second, are you actually the consumer? Because, Bernie, if you were going to go buy something at the store, you say, I want this thing, and you pay the money to the store, and then you get the thing. So if you think about it, the financial transaction in our for-profit healthcare system is between an insurer and a provider, not between you and the provider. It's between an insurer and a provider. So the reason why a financial transaction happened isn't the consumer. The reason a financial transaction happened is because you're the product, right? You're the reason that money changed hands from the actual consumer of healthcare, which is the insurance, to the provider of healthcare, the seller of healthcare, who is the hospitals and doctors. And I don't really want anybody to be a product in our country. I'd rather we be truly consumers. And the only way that that happens is if we disaggregate the for-profit insurance industry that is nickel and diming us every single way, forcing us to sit behind a paywall for a product we already paid for, right? And turning us more into the product than the consumer and the customer.
And by the way, as part of that, and say a word on this, it is an enormously complicated system.
That's right.
I mean, if you have a serious medical procedure, you end up in a hospital, you're going to be looking at bills and trying to figure out, what Blue Cross pays, what you pay out of pocket. And the guy at the other end we're spending a whole lot of money on him or her telling us what we owe or what we don't owe. Talk about the complexity of the system, what that means for the practicing physician.
That's right. It is insanely complex. And so, to use my hand analogies for a second, in America, we have 7,000 different insurance companies. They all have different billing procedures. They all cover different things. And then we have hospital providers. Now, when we think about what choice we want choice of doctors and hospitals. We want to go to the good doctor that we really like, who gets us and has taken care of you and your parents, right? You don't really quite care as much about the insurer. But here's the thing. Because there are 7,000 of them, every hospital provider needs to understand how to bill every insurer, which means that they have to hire an army of billers so that they can even interact with the army of billers on this side. Versus if you had one, right? Now there's just one insurer. You know exactly how they bill, what they bill for. You don't have to worry about whether or not it's going to be accepted, it's going to be rejected, right? And you just bill what would be Medicare under Medicare-for-all.
And importantly, you save as a nation hundreds of billions of dollars in doing away with all of this excessive administration.
That's
money
exactly
that
right.
could be put into doctors and nurses and disease prevention and rural clinics, et cetera, et cetera. All right. We're going to get back to you, Dr. El-Sayed, and let's go to Dr. Claudia Fegan, who is the Chief Medical Officer of Cook County Health. Dr. Fegan, thanks so much for being with us.
Thank you. Happy to be here.
Okay, you and I took a trip up to Toronto a few years ago, yeah?
We did.
We learned a little bit there. All right, you are on the front lines now dealing with the coronavirus. What are you seeing in Chicago now?
What we're seeing is not a surprise, is that our most vulnerable population, the people we knew as soon as we moved from people who had traveled abroad, who brought the virus, that once we went from that to community spread, so that so many people in the community have it, that the most vulnerable would suffer the most. And that's exactly what we're seeing. The majority of people who get sickest, who have the poorest outcomes, if I look at our ICUs, and we filled more than one, we filled 3 of our ICUs at county with COVID patients and on ventilators, doing poorly. The people who are doing the most, have the poorest outcomes, are people with diabetes, people with obesity, poor people who have problems with their health care anyway, and are usually present later and come with more advanced disease. So patients are afraid, they come in late, they're sick, and they do poorly quickly.
What is, Dr. Fegan, what is this terrible pandemic and economic crisis teaching us about the inadequacies of the current healthcare system?
Well, I think it's teaching us that unless we can provide access to everyone all the time, there's no way to get our arms around it in a crisis. That we have not been providing adequate access to healthcare for many years to a large percentage of the population. And so those folks are the ones who do poorly and who come in late, who don't have regular access and come into the emergency room. They don't know who to talk to. They don't know which symptoms they should be concerned about. And it's unfortunate because we could see this coming. We could see it from across the other side of the world coming, and we did not adequately prepare. And we're suffering more because of a lack of a systematic or organized approach. You know, that every state and every city is managing it differently. The idea that we don't have some uniformity in our approach. They're deciding the social distancing, that each state on its own has to decide when we would tell people to stay home, that we couldn't right away understand that this was a problem that needed to be addressed, that we needed to help the American public understand what the things they could do to protect themselves. We were late to the game on that. And as a result of that, many more people became sick and many more people will die. You know, I just wanted to comment on Dr. El Sayed's question. The problem with the insurance industry is that they add nothing to the product. If you're talking about a product, we pay them to tell us what care we can get, as opposed to them actually being proactive and saying, this is what a community needs and this is the services we should provide. So we pay them to limit the access to care at a time when we should be providing everyone with access and reaching out to our communities and touching patients before they become so seriously ill.
And by the way, we pay them a lot. Last year, the healthcare industry made $100 billion in profits.
And we could take care of a lot of people for that.
Couldn't we? In your judgment, what will it mean in this country when millions of people now are losing their jobs and losing their health insurance? What happens to those folks?
Well, so it's the same thing, you know, at county, I can remember before the Affordable Care Act, and I think that the Affordable Care Act was a valiant effort. It didn't go as far as you and I know we needed to go in terms of guaranteeing access. But before the Affordable Care Act, 80% of the outpatients that we saw at county were unfunded, and 56% of the inpatients were unfunded. The Affordable Care Act shifted that so that about 55% of the people we're taking care of are funded now. And as a result of losing your job, you lose your insurance, and that has such horrible economic repercussions. People lose their jobs, they lose their insurance, and oftentimes the consequences of that, they lose their homes, they lose their access, they lose their communities. It's everything that follows after that. And the idea that we are, due to a freak of history, the fact that we locked insurance to employment back during World War II to escape the wage and price freeze, and now we think that that's the way we should stay, we should have learned that lesson by now. It is cheaper to take care of everyone than to pay so much more to exclude people and then have people come in later and sicker and cost more to treat them.
How widely is your view and my view and the view of everybody on this panel held by the doctors you deal with every day?
Wow. So I've been talking about this for 30 years, and I used to be regarded as one of those fringe people on the outside, but now everyone acknowledges that, you know, it's the only way, it's the only solution, that until we acknowledge the amount of money we're spending would take care of everyone. And I didn't say every citizen. I said they'll take care of everyone living in this country. We spend enough money on healthcare. We let too many people who are not engaged in the delivery of healthcare take profit from it. That's our biggest problem.
Okay, well, thank you for what you're doing. I'm going to get back to you and the others in a minute, but I wanted to get to Michael Lighty. Michael worked for many, many years with the National Nurses United, the largest nurses union in the country, a union which is a strong advocate for Medicare-for-all. Michael, why don't you sometimes we talk policy and it sounds abstract and it sounds academic. Why don't you bring it down to earth, if you could, and talk about what does Medicare-for-all actually mean to the average person?
Thank you, Senator. I think it means something very fundamental that we don't have very much, particularly during the pandemic, and that's peace of mind. And that is that people need that sense of security, knowing that the healthcare they need is going to be there when they need it. And that's what they lack. Most Americans, this is their greatest economic concern, is can I afford the healthcare I need? So what Medicare-for-all provides is something very simple: guaranteed healthcare. There's all this abstract talk of universal healthcare, and as you all have been discussing, all the stuff that Americans need to know about healthcare, the difference between a bronze plan and a platinum plan, this deductible, this network, all that is crazy. What we have to know, right? And that's gone. Imagine going to the doctor, you don't show in, you show nothing, you show up and you get care. The doctor writes a prescription, you get the prescription, the doctor orders a test, you get a test, and you're treated. And you haven't paid anything out of pocket. And you've gotten the care you need and the prescription you need. That experience is so straightforward and so simple. Most folks in this country don't realize it's actually the everyday experience throughout the world.
That's the point that I wanted to make is I think people don't understand that 50 miles away from here, you go to any doctor you want, right? You don't like your doctor, you go to another doctor. We've talked to many Canadian friends whose family members have had major medical procedures, and kind of facetiously I say, what was the bill? You know, how much, after spending several weeks in the hospital, what was your bill? And they said, you know, parking the car was pretty expensive. That's what we had to pay for, parking the car. And in this country, you know, you're dealing with heart disease, dealing with cancer, you can come out with a few $100,000 in debt. In Canada, it is zero. A little bit differently all over the world. But your point is peace of mind. What would it mean to this country? I want everybody to understand this. If you get sick, if your parents get sick, if your kids get sick, you don't have to worry about how you're going to pay the bill. And I remember Dr. Fegan was with me when we were up in Toronto. And we went into a room where they were very kind. They let us in and we talked to a guy there who had undergone serious surgery. And he says, you know, the difference between what my American friends and I are dealing with is I have to worry about getting well. And I was pretty sick and it's not going to be easy. But I don't have to worry that my family is going to go bankrupt.
That's right.
So, go ahead, Michael.
Well, I don't think it's a coincidence that Representative Jayapal, yourself, Dr. Said, are very close to Canada. The closer you are to this experience, the reality is more stark. And I think we have so been inured to the present system, and we've so diminished our expectations about what it means to have healthcare. We just accept this. And I think the other aspect of this is for all of us to say, we deserve healthcare. We deserve guaranteed healthcare as a human right. And once we take that position, a lot of the stuff that's extraneous falls away. And a lot of the, I think, attitudes that some folks have is the feeling of resentment that someone else is getting a better deal. Someone else is getting a subsidy. Someone else is getting healthcare, but they're not. Imagine if everyone has healthcare, the resentment goes away. And the sense of solidarity, that sense that we're taking care of each other, which is what a healthcare system is for, I believe it can actually change the ethos in our country, Senator. I think we can, through a national healthcare system, develop a sense of solidarity, caring for each other that rejects the values of the industry of revenue and profit in favor of solidarity and caregiving. And to me, it is a profound opportunity for America to come together and take care of each other.
Michael, talk a little bit about the nature of the opposition. You've been doing this for a few years. You've run into the lobbyists. You've run into those who make huge campaign contributions from the industry. I ran into that, obviously, in my campaign. There are incredible political influence, not only over the Republican Party, but the Democratic Party as well. What's going on there?
Well, what's going on is that the healthcare industry is the leading lobbyist force in Washington, D.C., as you know. And the hospitals, some people think, oh, the hospitals, they're a good community-based institution. They spent $22 million last year on lobbying. They're the number 5th entity in terms of political spending in the country. And those are the hospitals. Add on the pharmaceutical corporations and the insurance industry, and you've got literally the most formidable corporate political force in the country that is deeply tied to both political parties. And I believe, Senator, that in fact, it's the politicians in many cases who are giving cover to the industry. They're actually the barrier to reform. as others have discussed, we get it in our gut that the system is broken and dysfunctional, as you've said. The industry spent millions during the primary campaign against you, against the idea, and yet every primary, a majority of Democratic voters supported Medicare for all. So we know in our gut, more than like 9% more Americans support Medicare for all than when the pandemic started. The momentum is on our side, people get it, and the industry is now confronting something in the political dynamic that they can't control, which is a pandemic. They're very used to pulling the levers of power, be it in policy, be it in political campaigns. They have, 3 lobbyists for every member of Congress? So they're used to this level of control. They've shaped reform for decades, and now the pandemic, I think, is the X factor, and it's changing.
And what I want the viewers to know is when Michael talks about campaign contributions or lobbyists, the amount of money they have is endless, endless. I will never forget, what was it, 2016, Michael? I was out in California working with you guys on a modest proposal to have California lower the cost of prescription drugs. Do you remember how much the industry spent on one ballot? I remember one ballot item in one state to prevent them from charging any price they wanted to the state. Remember what the number was? It was $130 million in one state.
Yeah.
One state. So that is what we are up against. Dr. El said, what does, and Michael touched on this, ease of mind, what does America look like when people can go to the doctor whenever they need to without worrying about the cost? When, because you have a rational healthcare system, healthcare is accessible. There are the clinics that you need in urban areas, in rural areas, that we do a much better job in preventing disease, in keeping people healthy. What does that kind of America look like as opposed to America working under the current healthcare system? Dr.
Yeah, I want to use the COVID-19 pandemic experience to just answer that question. For a long, long time, Americans have been used to having to ask whether or not X symptoms justify getting entangled in the medical morass. And for a lot of folks, the symptoms of, say, a fever and a dry cough are symptoms that they'd learn to ignore, because it may mean that if you're doing that before May 19th, which the Kaiser Family Foundation, which is a really, I think, effective healthcare analytics nonprofit, they calculated that the average day that the average person pays down their deductible, right, the amount of money that they have to pay so that their insurance kicks in, is May 19th. So if that's before May 19th, your healthcare, even if you already paid for it, is behind a paywall. And if you don't have insurance, you've got to pay for it anyway. So
I'm going to interrupt you because it's important to repeat what is so insane. You make a simple point, but it's so insane. What you're saying is people can't afford to get sick before May. Is that the point?
That's right. That you're going to get hit with a bill if you get sick before May. And so at some point, if it's before May, which, by the way, let's think about when flu season is, right? It usually happens before May. If it's before May, you say, you know what? Maybe I'm going to take my chances. So now we have a pandemic and it's still April, right? And you get these non-specific symptoms and you ask yourself, can I afford to have what I think I might have, right? This is how the system works. This is how it operates in the minds of people. And I want us to also remember that it's not just healthcare, right? It's the fact that you can't afford your healthcare in the setting of exploding inequality, which means that you probably work a gig instead of a full-time job, which means that you don't really have benefits that you can rely upon. And all of the basic infrastructure, the cost of your car insurance, the cost of your car itself, the cost of your housing, right? All of that is increasing in costs. Your ability to pay is going down. We don't have a basic living wage. All of these things create a level of baseline insecurity. I just finished a book, Senator, and I talk about this epidemic of insecurity, right? That, like, as I campaigned for governor of Michigan, and you were extremely supportive in that effort. And I traveled my state, which is a pretty important state on the electoral map. And I had thought going into this campaign, I'm an epidemiologist by training, that the challenges that poor and working people face in a place like Detroit and Flint would be very different than the challenges that poor and working people faced in a place like the Upper Peninsula. And it turned out they're all talking about the same questions: healthcare, housing, water in a state that's defined by its fresh water. And so we can't disaggregate these issues because they all compile on each other. And so you can imagine just solving this one, and there are many others that you've led on solving, but imagine just addressing this one, that if my body or my mind were to get sick, that at least I know I can go speak to a professional and I can afford what I might have, that I can afford to get sick, or my kid can afford to get sick without sending me fundamentally into bankruptcy. I mean, that peace of mind, that security, right, is something that every person living anywhere in the world, but certainly living in the richest, most powerful country in the world, should take for granted. And it's a sad reality that until May 19th, nobody can, or the median American can, unless you're extremely rich.
All right, let me jump to Dr. Fegan and pick up on what Dr. El-Sayed pointed out. What does it do physiologically, if you like, to the human body to have to live under the kind of stress that tells you that, I'm sick, but I can't afford to go to the doctor. I'm worried about my parent, but I can't take good care of her. What does this incredible amount of stress and anxiety do to us physically?
It destroys us. We know that in Chicago, there's an expression, zip code matters. And it means that people who live in poor communities, who live in communities with lots of stress, lots of poverty, poor education, poor jobs, die younger, as much as 20 years younger than people who live in the wealthy or well-to-do neighborhoods. And it's not all just about having more money, it's about the stress or anxiety. You realize that how perverted the system is. People, even if you can afford to go to a doctor, do you realize that a third of prescriptions written in this country are never filled? Why would someone bother to go to a doctor for them to recommend a treatment and then never fill the prescription? Part of it has to do with the cost. When they get to the pharmacy and they can't afford the medication. It has to do with, so people live in constantly trying to balance the cost of what the healthcare would be, what the cost of the doctor's visit, and then the cost of the prescription, and trying to figure out, are they going to put food on the table? Are they going to pay rent? Or are they going to pay for this cost of care? And if we talk about hypertension being the silent killer. People don't have symptoms from hypertension. So I can keep driving my cab or driving my Uber. I can keep, doing this job right now. I'll go to the doctor at some point in the future, but I can't afford to do it right now. I can't afford, for something that I don't feel pain or feel discomfort as a result of. People who have diabetes, who don't, feel bad. It's not until they're really advanced that they have symptoms. And so these are deaths that are preventable deaths. How many people die in this country every year as a result of preventable illness? Because we don't have a society where that's just an expectation that you would go to the doctor, they would take care of you, they would make recommendations, and you could take that advice. You could take care of yourself and take care of your family. Or the breadwinner who says, I will pay for it so that the children can have their immunizations, but you're not taking your blood pressure medicine or taking your diabetes medicine.
I mean, correct me, tell me what I'm missing here. But if I am sick, as you indicated, and I go to a doctor and I get a prescription, and I cannot afford to fill that prescription, you know what? The strong likelihood is I'm going to get even sicker. And I may end up in the hospital at a cost 1,000 times more than if I was able to afford that medicine. Is that right?
That's exactly right. I say to patients every day, I would far rather control your blood pressure than take care of you after your stroke. And after your stroke, you're less likely to be a contributing member of our society. Your body has been devastated. And it was something that we could have prevented. We could have allowed you to continue to be a contributing member to society, to your family. And now you become someone we have to take care of.
Last year, I took a trip actually from Detroit into Canada, and we bought insulin there for 1/10 the price that was paid in the United States. And I learned on that trip that a significant number of people with diabetes in this country cannot afford the insulin. They're rationing their insulin. What happens when you ration insulin?
Well, that's exactly right. And it didn't used to be that expensive. That's a very important point. But now with the consolidation of the pharmaceutical industry and the opportunity to raise the price of something that could be relatively inexpensive. So when you don't take a sufficient amount of insulin, the diabetes is not controlled. And when it's not controlled, that's when we have the problems with the damage to your eyes, damage to your kidneys, damage to your heart. You know, it ravages the organs of the body. And so here was an opportunity to provide preventive services, to take care of people, and they're taking just enough to get by because they cannot afford to take it on a, you know, people say we don't want to have universal health care because we don't want to ration health care. We are rationing health care in the United States. We don't ration it on the basis of need or on the basis of how much we have. We ration health care on the basis of your ability to afford it. If you have enough money, you can pay to have it. And if you don't have access to it.
And the insanity is by not doing the prevention, by not providing the care when it's needed, people end up in the hospital and they run bills of tens of thousands of dollars.
It costs us more. It costs us more every time.
And not to mention, we do a great disservice to the children of this country.
Who were raised without mothers and without fathers because they died too young. They died unnecessarily. We watch people who come with advanced cancers because they were afraid. They didn't have the money. They didn't want to come to, they have to come to the emergency room instead of us doing the diagnostic, the preventive studies. Mammograms save lives. Colonoscopies save lives. There are things we know we can do to find disease sooner and make a difference, to change. No one has to die from colon cancer. Women should not die from cervical cancer in this country, and yet they do because pap smears save lives. And when people don't get them, they present with advanced disease that there's little we can do.
Let me jump over to Michael. I mean, it's just when you think about it, the dysfunctionality, the irrationality, the cruelty of the current system is indefensible. And yet it is propped up because you have an industry based on greed, paying their CEOs in the insurance industry and the pharmaceutical industry, in some cases, tens of millions of dollars a year, making enormous profits. All right, Michael, how do we take this down? How do we take them on effectively and move toward a rational healthcare system, which in my mind is Medicare-for-all?
Well, it takes leadership, which you provided, which Congressmember Jayapal has provided. That's crucial. It takes a movement, and we are stronger as a movement for Medicare, for improved Medicare for all than we've ever been. The Physicians for National Health program got the American Medical Association, particularly the students, the medical students, got the American Medical Association to leave the Partnership for America's Healthcare Future, which is the primary industry trade group, right, that is sponsoring all the opposition to Medicare for all. So what we found during the campaign is that we can beat them. When we have a real debate, as Speaker said, we've won, as Rep. Jayapal said, we've won the policy argument. This is a political fight. It's a question of political will. We are going to have to send the message to political leaders that they must pivot from the employment-based system to a system of guaranteed health care through Medicare for all. That's the pivot we need from every elected Democrat in this country. And I think we should never negate the fact that 52% of Republicans earning less than $30,000 a year support a federal guarantee of health care. This is an issue that affects working class Republicans. It affects people of color and communities of color dramatically. And what we're seeing is a coalescence, I think, during the pandemic, a recognition that universal healthcare is the only way to go. We're going to use literally trillions of dollars of taxpayer money, hundreds of billions of that, perhaps $1 trillion of that, into healthcare. The question is not, are we going to have a publicly financed healthcare system? The question is, how are we going to do it? And the way to do it through Medicare for all saves money, guarantees comprehensive benefits to everybody, eliminates the out-of-pocket expenses. We have the argument on our side. I believe we need to actually force through movement work, to the social media work we've been doing, and when we can get back on the streets, the kind of organizing that moves elected officials to a position of guaranteed healthcare. I think we can do it in the pandemic, and I think that's what it's going to take. But I will also say this. We have to talk about this system as a doctor and nurse-led system, what we envision. And people in this country want to hear more from nurses and doctors. We've got to get those
You are absolutely right on that one. And I want to applaud the National Nurses United. They have been in the forefront of this fight. As you've indicated, we have major doctors' organizations now coming on. I mean, it's one thing for a politician to make the case. That's important. It is more important for doctors who are on the front line, for nurses who are saying, you know what, I can't do what I was trained to do, or I'm losing patients day after day because, as Dr. El-Sayed said, people are coming in too late. Dr. Fegan said that. So I think we need doctors and nurses, medical professionals to say, you know what, we are not able to do the job that we are sworn to do because of a system that is so dysfunctional. And I think we are making progress in bringing doctors' organizations and nurses into the struggle, but that has got to be a very, very important part of where we go forward. Dr. El-Sayed, anything you want to add to before we get to the some of the questions that are out there?
The only thing I'll add, Senator, is that this fight is one that cannot be given up, because I think time, and I think, frankly, the insurance industry's greed is on our side. One of the things I came to appreciate is that in the past, these fights for universal health coverage have often been conveniently ignored by people of means and privilege, because coverage in this country used to mean something. And I think what we've started to see now is that even the median American, right, that median American behind a $1,500 deductible paywall, who's not paying down their deductible until May 19th, they're in this fight now too. And I think when the reason why we've seen across the board victories for, and let's be clear, the pollsters didn't do us any favors. They didn't call it Medicare-for-all. They called it government health insurance for all, right? And even across the board victories for that, I think, speak to the reality that everybody in this country is realizing that the system is unsustainable. It's unsustainable because of the greed of a very few, and that it's not working for folks when they need it most. And so I think we cannot give up this fight. Time, the work, the insurance industry's own greed is on our side. And so I hope that folks don't ever get disheartened by sometimes the minor setbacks that we feel, because there are too many people who struggle on the wrong end of a usurious insurance system. And we've got a responsibility to always keep the fight up for them.
No, I absolutely agree. We can beat these guys. As I think all of you have said, they are enormously powerful. They have unlimited amounts of money. They are incredibly greedy. But the American people understand that this is an issue of life and death. They're seeing it now very clearly, with millions of people losing their health insurance. And this is a fight that we have to mobilize the grassroots to win, mobilize the medical profession to win, and we will win. Let me jump now to, I guess, Pramila. Pramila is back on. Pramila, you here with us? Oh, not yet. She will be. Okay. Let me start off with Giulio Ferretti, who writes, this is his question. Why do you think so many Americans do not want to listen or believe to the experience of people living in countries with universal healthcare systems? And let me pick up on that question from Giulio. How much do the American people actually know what's going on in other countries? How many Americans know that we are the only major country not to guarantee healthcare to all people? That we in some cases spend 10 times more than other countries for the same exact prescription drugs? Have there been terribly many television programs which contrast American healthcare with the Canadian system or Scandinavian systems? Who wants to take a shot at that?
You know, I think that one of the challenges is our American exceptionalism. We always believe we're the best and the greatest. And we don't, there's a lot of publicity out there. There are a lot of people who are marketing saying, you know, in Canada, they have waiting lists and they can't get access to care. It's a lot of propaganda that's put out to make us believe that that's an inferior system, that we cannot, we have a much better system here. But that kind of ignores the fact of how many people die as a result of just not having health insurance. And it ignores the fact that when I ask people, well, how long do you have to wait to get a knee replacement in the United States? And people say, I don't know. I said, that's because we don't track it. We have no idea how many people die as a result of not, coming in to be seen. We don't count it. And so because the Canadians do, and they pay attention to that, we have this arrogance to believe that we do it better. We do it better only for those who can afford it. And
I wanted to jump in there and mention there have been some studies. They're all estimates, obviously, but there are estimates that we lose between 30,000 and 60,000 people every year from preventable diseases if they had come into the doctor's office when they should have. Have you seen that in your own practice?
Oh, absolutely. Absolutely. So it's that fear, that anxiety, that, what's it going to cost? If we look at, as you mentioned at the beginning, how many bankruptcies are related to health care, to medical illness or medical debt. I don't care how much insurance you have. People think, well, I have a good insurance policy. My husband had a hospital bill of $200,000. So what's a good policy if you have to pay 20% of that or only 10% of that? That's a good policy. So you got $20,000 hanging around to pay your deductible on a $200,000 hospital bill. I mean, it's this whole concept that we don't know what it's like in other countries. We only hear propaganda about what it's like. And we think that it's so wonderful here because we don't know any better. The idea is, as Michael was talking about, not having to worry about what it was going to cost, that you would just, if you had a problem or concern, you could go and you could see someone and they could take care of you without worrying about whether you had enough money to pay for the visit.
I think this touches on a very, very fundamental issue. And that is, what do we consider to be a human right? And how come in other countries, what they say is, whether you're rich or whether you're poor, when you get sick, it is your human right to be able to get the medical care that you need. What does it take in your judgment to move the American people to understand, to say, excuse me, I am a human being, and I'm going to go to the doctor when I need to. My kids are going to get the best care available. My parents are going to get the best care available. So I think the broader issue is what has been pounded into our heads is what we are entitled to as human beings. Anyone want to pick up? Pramila, I think, has rejoined us. Let me throw that out to you, Pramila. Does that make sense to you?
Thank you, Senator. It does make sense. And, I think it's what we have a right to and what we deserve. And I think people have been beaten down to think that somehow in every other developed country in the world that they deserve health care and that they have a right to health care. And here in the United States, that somehow we have a system that is so exceptional that we actually are not going to give health care to people. And so to me, it is also about encouraging people to believe that, yes, this is a right. Yes, you deserve it. And yes, you can fight for it. And I think as we see the deaths continue to increase, the illnesses continue to increase, the fact that people, I'm also in a border state here in Washington, our folks drive to Canada, just like you, to get their medications because it's so much cheaper. You pay, a tenth of the price for insulin in Canada. And so I think that one of the things that is important is to put the vision out there and to say, we can do this and you can help us to fight for it. But at the end of the day, it's also about defeating those special interests and having the courage to do what we know we can do. This isn't about what we can't do. It's not about scarcity. It's about greed and in the current system. And it is about really ensuring that people know that if they're sick, they can go get care.
Okay, let me go to Michael. Michael, what do we have to do as a nation to get people to understand that healthcare is in fact a human right, that they are entitled to it, their families are entitled to it? How do we go forward on that?
Well, one thing we haven't mentioned, Senator, and that is the responsibility of the media. And I do think that it's very indicative that really until your national campaigns in 2016 and 2020, it really wasn't on the political agenda. It wasn't on the radar. It wasn't being discussed in mainstream media very often. But still, even after all this time, you've got mainstream media who doesn't put advocates for Medicare for all on the table or on the television, on the screen. We don't put the policy on the table and actually investigate it. 60 minutes.
Let me interrupt you to suggest, maybe I'm wrong, and somebody jump in if you think I'm wrong, the kind of discussion that we are having tonight, a lengthy discussion on why this country needs to move to Medicare for all, because we believe that healthcare is a human right. Anybody on the panel ever seen that discussion in the corporate media? Any program on CBS, NBC, Fox?
No, and in fact, when we've tried to push for it, we get pushed back. The only questions that get asked are, oh, it's so expensive. Nobody ever lets us explain that it's got to be compared to the cost of losing lives and the cost of what we're currently spending, which is far more expensive than a Medicare for all system. So they're not interested in having that discussion.
But that really does get into what this struggle is all about. And it's not only taken on the insurance industry and the drug companies, but taking on a corporate media, which receives billions of dollars a year in advertising from the pharmaceutical industry and the insurance companies. Anyone want to add anything to that? I'm interested, to me, the struggle is, and I think it was Pramila, has talked about the American people being beaten down. And I think the struggle in the deepest sense of the word is, what are we entitled to as human beings? Do we need 500,000 people sleeping out on the street? Do we need 30% or 20% of our children and a third of African-American kids living in poverty? Really? While 3 people own more wealth than the bottom half of this country. So this goes beyond the debate over healthcare. Because I think if people wake up and say, excuse me, I'm a human being, this is what I am entitled to, that is the beginning of a political revolution. Abdul, you want to jump in on that one? Or?
Yeah, I just want to add that part of the challenge right now is I think that sense of being beaten down, of being so deeply insecure by watching the system whittle away at what you have, leaves people so worried about what they're going to lose,
right,
that we are unwilling to come together to fight for what we could gain. And we have to get past a 40-year governing consensus that tells us that somehow corporations can do basic public goods better than government can do basic public goods. And 2 points here. Number one, I think there is a moment where when you hit rock bottom, you realize that it's not just about what folks are going to take away, because there's nothing left to take away. And I think this pandemic may, in some respects, represent a rock bottom. And the sad truth of it is that when this is all over, the high likelihood is that most folks are going to know somebody who either got really, really sick or potentially passed away. I know that in my social circle, I know 4 people already who've passed away because of COVID-19. And that's forcing us to ask really basic questions about how we provide really basic things for people. So I think that's number one. But number two, we have to realize, and I hope that this pandemic's shown us, is that we are as vulnerable. All of us are as vulnerable as the most vulnerable. All of us are as exposed as the most exposed. And you think about the act of social distancing. If any one person cheats, right, that means that there's more disease that all of us could potentially suffer from. And so I do hope that this reminds us that, in fact, there is a such thing called society. There is a such thing called a collective. And that if we don't pay attention to the suffering of people who our privilege protects us from being, then their suffering will someday potentially become our suffering.
Let me pick up on that point and talk about a very ugly situation that now exists. And that is Congress last month passed a $2.2 trillion CARES Act, some bad things in it, some good things in it. But you know what? It excluded the undocumented. How's that? So to pick up on your point, there are people working in packing houses, and you're all familiar with what's going on in South Dakota. 500 people diagnosed with the coronavirus. How many of them are undocumented? I don't know, but many of them are immigrants. Immigrants all over this country doing some of the most difficult and in this moment dangerous work, and yet they cannot benefit from any of the provisions that we recently passed, despite, by the way, they are paying taxes. So to pick up on your point, isn't that brilliant that we deny somebody who is undocumented the ability to go to the doctor to get a diagnosis, and we let that person go around maybe spreading the illness? Am I missing something, or is that patently insane? Who wants to jump in on that one?
That's absolutely right. So I talked to people a lot about this issue, and I asked them how many people went out to a restaurant in the previous week. And lots of times people raised their hands. And I said, so who prepared that food? What do you know about the immigration status of the person who washed the dishes or prepared your food? And what do you know about their TB status? And now I could ask you, what do you know about their COVID status? You know, how do you know that the person, if you ride public transportation, if you walk down the street, you are only as safe as the person next to you, the person walking ahead of you. If you rode on a plane, you know, so this assumption that we're only going to take care of those people who are documented as opposed to everyone who lives within our borders means that we leave ourselves vulnerable to a public health pandemic like we're in the midst of now.
Not only do we suffer, who are legal citizens, but think about what we're doing to those human beings as well.
Well,
yeah.
And Senator, if I could just add to this, you know, I've worked on immigration for 20 years, and the callousness of this particular issue, when we say that people are essential workers, if they're out there picking our food supply that's going into our food banks or on our tables, and then at the same time, we say, not only are you not eligible for relief, and by the way, it wasn't just undocumented immigrants, even legal permanent residents and DACA recipients were not eligible for stimulus checks. If you were a U.S. citizen and you were married to somebody who filed their taxes with an ITIN number, you were still not eligible for your stimulus check. So not only is that just so callous, but it also is, I think, an indication of the broader question of those people are also facing ICE enforcement coming out and trying to find them and deport them. That has not slowed down during this crisis. We've been trying to get, I have a bill that I just introduced to try to get people that are in detention centers out of detention centers. The vast majority of people who are there have never been charged with a crime, never committed a crime, much less been charged with a crime. They're all crowded together. And of course, here again, you've got the people who are, workers, employees in the detention centers who could get infected, who could take it out to their families and into the public. So from a public health perspective, and also from a hypocrisy perspective of saying these folks are essential, but then we're not even going to allow you to get benefits or stay in the country.
And as you indicated, guess what? They pay taxes.
Right.
For benefits that they cannot receive. All right, let me go to another question. This is from David Thompson, and this touches on an issue that I heard a lot during the campaign. David writes, so much of our wealth comes from employment in insurance companies. What happens when we end all of those jobs? In other words, he makes the fair point that when we create a simpler, more cost-effective system, and we don't spend billions and billions of dollars on people whose job it is to tell us that we're not covered for what we thought we paid for, and we end that administrative nightmare, people will lose their jobs. That's true. What's the answer to that? I know what the answer is, but I want to throw it to you or anybody else out there. Michael Lighty.
I'll jump in. I know both of you have great bills on this subject, so I'm presumptuous. I'm sorry. But I would say we studied this issue. There are about 1.8 million workers on the insurance industry side and on the healthcare administrative side who will be affected. We're saving $450 billion. So employment is going to be affected. But both of your legislation has transition programs to do income maintenance, to do job retraining, to do job placement, and to bridge to pension and retirement if necessary. We've got to do that for the fossil fuel industry as well.
Exactly.
So this is the model that we will do to do a just transition.
Not to mention that when we open the healthcare system to all people, regardless of income, so that people can go to a doctor or a dentist or a nurse's office when they have to, guess what? And when we do a better job in taking care of our seniors and our children, we're gonna have far more employment in terms of people providing actual health care rather than pushing paper.
And we could put a lot of those doctors and nurses back to work at the bedside. So the insurance industry uses so many people to screen, to listen to whether they think a treatment is appropriate. We could use those people at the bedside, and when we're providing care to everyone, we'll need those folks.
Right.
And including those people who've been pushing paper, we'll need them too, to deliver the care that and to administer the care that we want to provide to everyone.
So the difference here is what we are talking about is using people to improve the life and the health of the American people. Actually, the provision of healthcare in one form or another, rather than sitting around saying to somebody, I'm sorry, you're not covered, we're not covering this procedure. That is useless. That's just administratively expensive, and the results are useless. Once you open the door and say all people are entitled to healthcare, we're gonna need more healthcare providers at every level. And we didn't touch on another issue, which we cover in our bill as well, not talked about enough, that is dental care. How do we talk about healthcare without talking about dental care? Anyone have a thought on that one?
Well, I think, our bills expand all of those things that you need for basic health. So dental care is tied to diabetes. These are deeply connected issues around a number of different illnesses and the ultimate goal is let's get you the care that you need in the most comprehensive way, because there are effects of one thing related to another. And I don't even think we look at those things. I wanted to say one other thing about the insurance industry. And Michael, you did such a great job of describing the bills because you all were very engaged in helping us to craft some of that. I find it funny that we talk about this not in the way we talk about innovation in other arenas. This has been the history of our world, is that we innovate, we move to things that are more efficient. And that is what a Medicare-for-all proposal is more efficient, more streamlined, and more comprehensive way of delivering healthcare services. Anyone who believes in the innovation industry should really love this proposal, because that's what it does. And I think that is a really important point to think about and to push back on as we talk about what we're trying to do here. We should not be just trying to preserve jobs for the sake of those jobs, because the innovation industry says we'll adapt. There's a CEO of a major hospital on the East Coast that I spoke to who told me that they have to employ 300 people they're a safety net hospital, just to argue with the claims people in the insurance industry to get for their patients what they need. And I've got to believe that those people that are doing those jobs aren't that thrilled about having to do a job where they're just denying people health care.
And Pramila, we're paying those people, that's part of our healthcare costs, and we're paying people at the insurance companies to argue with them.
That's right.
All right, got an interesting question here, again, a question that comes up very often, and this comes from a supporter of President Trump, and we're glad he is watching the program. His name is Aaron Stair. Question is, how will you pay for it? How will you pay for Medicare-for-all? And how will you avoid my pocket? That's the question.
Can I?
Yes.
Aaron, thank you for joining. An open mind is a rare thing these days, so grateful that you're with us. That's a question we ask a lot, and I want to say a couple of things. Number one, I want you to think about how much money your family pays for health insurance every single month, and then when you actually have to get care, and how much that adds up to. I think big numbers are really hard when we always talk about the billions and the trillions. I'm not smart enough to think about them. I like to think in terms of what are my dollars and cents every 2 weeks. And I ran on a single payer platform. And when we ran, we just looked at a very simple number. The median Michigander earns $48,000 a year. They pay a certain amount of that in health insurance. How much would they pay if we were to reform healthcare so that there were no deductibles, there were no copays, and there were no premiums, and instead there was some amount that they paid in taxes and then some amount employers paid in taxes? And we found that the average Michigander would pay or would keep $5,000 a year, have unlimited access to healthcare, and not have to worry about the insecurity of not being able to pay at the point of care. That's a pretty simple proposition. So, Aaron, you would keep $5,000, assuming you're the median individual, you would keep $5,000 a month, right? And excuse me, $5,000 a year. And we would pay for it through a simple set of taxes that are progressive, meaning that they're fairer. The more you have, the higher proportion, because of course you don't need that much more. And you know what we wouldn't be paying for is all of the overhead we just talked about. We wouldn't be paying for CEO salaries, which in Michigan, Blue Cross Blue Shield CEO made $19 million last year, so we wouldn't be paying for that. We wouldn't be paying for the marketing budget for Blue Cross versus HAP versus all the other Cignas versus Aetna versus all these other folks. And it would save us money. So that's how. Aaron, thank you for listening.
All right. Well, thank you for that question, Aaron. And let me pick up on what Abdul said, and that is, to the best of my knowledge, median family income in America is about $60,000. That average family pays about $12,000 a year. 20% of your income goes into premiums, it goes into co-payments, it goes into prescription drugs, it goes into out-of-pocket expenses. That is an incredibly reactionary way to pay for healthcare. Imagine that, 20% of your income. So what our opposition does, what the industry does, and what politicians do is they say, these politicians want to raise your taxes. Well, there's truth to that. But what we want to do is do away with your premiums, your co-payments, your out-of-pocket expenses, and substantially lower the cost of prescription drugs, such that, as Abdul just indicated, in Michigan, you estimated the average family would save about $5,000 a year. Okay. And that's the bottom line. That's the bottom line, because we're talking about a system that is far more efficient, doesn't have massive amounts of administrative waste, is not geared toward profiteering or outrageous executive compensation packages. Anyone want to jump in, Mike? I know that you have studied the issue of how we pay for this thing a little bit. Michael Lighty, you want to jump in there?
Sure, just quickly, Senator. I think it's important, Aaron, and for everyone to understand that we pay for everything in the current healthcare system. That the dollars that are in the system are from us. Either it's the raise we didn't get, the copay we paid at the doctor's office or at the pharmacy, or the check we wrote at home. We're paying for everything. The pharmaceutical ads that we see on TV. There's one other country in the world that lets pharmaceutical companies market like that. So I think what we're doing is we're paying for everything but not getting our money's worth. 60% of the healthcare costs are covered by taxpayers. It makes no sense to try to cover everybody by subsidizing the purchase of private insurance. That's what it comes down to, is subsidizing the purchase of a for-profit product that will then deny us care, because the business model depends upon denials of care, as well as the tax subsidies that really prop it up. And so the question, I think, for taxpayers is, why should we subsidize their profits and executive salaries when we could pay for it directly, more efficiently, and cover everybody with comprehensive benefits? Better benefits than every plan's getting now. So I do think the pivot point, Senator, is what you started with. We have got to, through this pandemic, pivot, and we need democratic leadership, especially to pivot and say, yes, we are done with the job-based employment system that was established in World War II, as Representative Jayapal said. And we will no longer let money be the metric of good medicine, which is what the healthcare industry has established. Just like we all deserve healthcare, those Essential workers deserve protection. Our healthcare workers, nurses, and doctors deserve protection. And it all comes down to that basic belief, right, that it's a caregiving system, not an industry for profit and greed.
Good. All right, let me close. We got a lot of questions here. Let me close on a question asked by Zoe Kaplan-Lewis. And she writes, if Medicare-for-all had been available to everyone in the United States starting in 2017, what are 3 differences we would see in the present day? In other words, it gets back to the issue for the average person. And again, sometimes we talk about $1 trillion here and $1 trillion there and hundreds of billions. What does it mean? How would life look today differently than it did back in 2017 if today we had a Medicare-for-all single payer program? Who wants to jump in on that one? Claudia, you want to take a shot at that?
Yeah, so I think Michael talked about peace of mind. Think about how many people went bankrupt in the last 4 years as a result of medical illness or medical debt. And how about the notion that we as a society begin to level the playing field in terms of your life expectancy being so tied to your job, so tied to how much money you could make, that your life expectancy would be based on your ability to take the medication, to make the lifestyle changes, to live, longer and be a part of the lives of the rest of your family. So I always tell people, if you drove a car or you ate a box of cereal or you're sitting at a table that was made in the United States, you paid more for it because of a lack of a healthcare system in this country, because you had to pay for the disparity of the healthcare benefits of the workers who built that car or the people who boxed that cereal or even who printed that newspaper. So how about that peace of mind that Michael was talking about before? How about the notion that that was something, one less stressor, a big stressor that you could take away from people who have to get up every day and work to support their families, that they would know this is one thing, that if something, some medical illness befalls me, that I'll be taken care of, that my family will be taken care of, that it won't result in us losing everything, losing our home. The most horrible thing is I see a woman who has gotten breast cancer and who actually, because of her breast cancer, lost her job because she wasn't able to go to work. And as a result of losing her job, she lost her home. So the first time I saw her for her first visit, she and her daughter were living out of a car and she needed to get, access to treatment. How about not having those things happen anymore? How about we just begin to actually take care of each other as a society? It's something that would make you feel better each night you went to bed.
I'd love to end on that beautiful note, but I got another question popped up in my mind, so I'm going to ask a question here. I'll jump the line here. And, we're talking about access to medical care, but are we as a nation doing enough in terms of disease prevention? Are we doing enough to keep our people healthy? What we talked about a moment ago, and Claudia talked about that, is we save money when we keep people healthy, when we treat them when they're ill, rather than hospitalize them. Abdul, what can we be doing better in a rational, not-for-profit healthcare system to keep people healthy?
Yeah, I was gonna add to. I didn't want to put anything behind Claudia's beautiful reflection. But since you asked the question, we spend less than 2.5% of our healthcare budget in this country on prevention and public health, and we are in the middle of a global pandemic. And it's not to say necessarily that this particular pandemic would have been prevented, but it could have been prevented. And the way you would have prevented it is by investing in the means of prevention, right? I think about a pandemic like a toaster fire gone awry, right? It starts small. And if you put it out when it's still in the toaster, you're good. But if you've taken the batteries out of the fire alarm, you furloughed the entire fire station, well, when you have a toaster fire, you may not know it. And then it becomes a fire in the house, and then it becomes a 4-alarm fire in the entire neighborhood. And that's where we are right now. And so it's not just this pandemic, but it's also all of the mundane diseases that we take for granted all the time. all of the unnecessary diabetes, all of the unnecessary heart disease, all of the unnecessary strokes, all of the unnecessary cancers that could have been prevented if we invested in it. And I want to make the connection here so folks understand exactly why. Right now, you have 7,000 different health insurers. None of them have the incentive to prevent any disease because you know what? They're backstopped by Medicare as it stands. They know that they're going to put all this money into prevention now, and Medicare is going to pay on the back end. So why would you do it? And so we're missing the opportunity. But if you had Medicare for all, meaning Medicare for the entire lifespan, every dollar invested in prevention early is a dollar netted late. And so because you have the same payer that is both investing in prevention and investing in disease treatment, right? Because of that alignment and incentive, there is so much more incentive to invest.
I save money on the Medicare for all. I save money when I prevent disease and I keep people healthy.
That's right.
Anyone have anything to add on that?
It's important. Sorry, Representative, go ahead.
I just say that the average person stays in any particular insurance plan for less than 2 years. Where is the incentive for an insurance company to pay for the preventive services when if that person gets cancer, it's going to be on someone else's watch? They're not going to have to pay that bill. There's no financial incentive for the insurance industry to fund prevention. At least we have not structured it in such a way that they see it.
Right, good point. Anyone else want to jump on that?
Senator, I was going to say that when I was listening to Abdul, I was thinking about the 10 years I spent working in international public health in other countries. These are countries that are far less wealthy than the United States, incredibly poor, actually. And we were, trying to help people understand why prevention was so important for all the reasons that Abdul has talked about. And because we really did understand that unless you caught something early on, if you can drive illness to the earliest point of contact with the health system, that is where you're not only going to save a lot of lives, prevent people from getting ill, getting diseases that may be permanent, but you're also going to save a lot of money. And when I came to the United States and I realized that we don't do that here. I mean, it's what we're trying to promote internationally, but we're not doing that here. We're not trying to push care to the earliest possible point. And most of the savings analyses of cost don't really look at what the cost savings would be if you were to get healthcare to that earliest point. That's a whole nother enormous bucket of savings, including saved lives, but also in terms of costs of that additional disease. And when Karen was giving her beautiful reflection earlier, I was also thinking about the fact that even people, what would be different? You would have more time on your hands because you would not be arguing with doctors, insurance companies. You would be healthier, and you would not be trying to raise money on GoFundMe. I mean, the craziness of the fact that a third of GoFundMe campaigns are related to medical illness and trying to just appeal to your neighbor or somebody you don't know to fund a campaign for your medical bills is again, I think, a level of, I used the word callousness earlier, but it keeps coming up for me as the word that we are dealing with the healthcare system. So savings, better health, more time, more security, and a more integrated, prepared country that hopefully would be able to prevent these kinds of pandemics better.
On that note, let me thank our panelists. It's been a fantastic discussion. I want to thank Pramila Jayapal from the state of Washington, Congresswoman Abdul El Sayed from Michigan, Congress physician and former public health director in Detroit, Dr. Claudia Fegan from the Cook County, medical officer at Cook County Health, Michael Lighty, worked with the National Nurses Union for many, many years. I want to thank Laura Jean Anderson for the music that began the program. And now we're going to conclude with music from Max, who is a pop singer and actor from New York City. Guys, thank you all very, very much. Talk to you soon. Good night, everybody.
Good night.
What's up, guys? I'm Max, and this is my Bernie 2020 session. I got to be a part of Bernie's rally in New York, my hometown, a couple months back, which was so special. I've been a supporter for the last 6-7 years, and my parents have been supporters for a very long time as well. And I support Bernie because he is authentic, he is true to his word, he is always of service to the people of our country. And I think a president and anyone who's a part of our government should be of service to its people in the same way that our military, who we support and give love to, are of service to this country. And we don't always have presidents like that. So I think Bernie Sanders would be an incredible president, and that's why we support him. I'll play a couple songs. Hopefully you guys know these few, and hope you enjoy. This first one is called Lights Down Low, and let's go. Let's do it, Bernie. Thank you very much. We got one more song for you guys. It's a little more recent one of mine. It's called Love Me Less. And yeah, again, shouts to Bernie, our man. Let's go. President 2020. Yeah, here we go. Yeah. So, love me less? No, 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 no. I've got too much dirt to come clean. Glasses full of skeletons that you don't want to see. When you judge me, I'm ugly. I won't blame you if you do. And no lies, don't want to keep no secrets. Even if what I'm saying is speechless. Yeah, no secrets. And if I introduce you to my demons, tell me, baby, would you love me less? If you know the places that I've been, if you know the damage that I did, would you love me less? No, 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 no. Would you love me less? If I had a dollar for my sins, if you know the bed that I've been in, would you love me less? No, 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 no. Now I'm happy you never saw me in college. Blood on my hands, I refuse to acknowledge why I get lightheaded. Then I say I'm dreading soft conversation, and I bet my skin sweat. She doesn't like my list of exes I've had home. She's bugging, sounding childish like a xylophone. He's bugging, hearing that falsetto, they sing the tone. If I introduce you to my demons, tell me, baby, would you love me less? If you know the basics that I've been, if you know the damage that I did, oh, would you love me less? No, 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 no. Would you love me less? If I had a dollar for my sins, if you know the bed that I've been in, oh, would you love me less? No, 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 no. Or would you love me more? Or would you love me more? If you knew the person that I was, yeah, yeah, yeah. And if you knew the power of your love to change me. If I introduce you to my demons, tell me you won't love me less. Hey. If you know the damage that I did, oh, would you love me less? No, 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 no. Would you love me less? If I had a dollar for my sins, if you know the days that I've been in, oh, would you love me less? No, 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 no. Thank you guys so much. Again, I'm Max, and I'm honored to be a part of Bernie's rally, Bernie Session 2020, supporting Bernie all the way. Let's go all the way to the presidency. And thank you for being of service to our country and always being incredible in the Senate and being part of our government in the best way possible. Much love. Have a great day, guys. Thank you.